Cover everybody, and the bills actually say every resident, not every citizen, every resident. So cover everybody, no copays, comprehensive benefits, see any doctor, reduce the nation's costs. How in the world can we afford this? So I told you my background included working within industry at Express Scripts. The economics of this, I would not be on board talking about this if I didn't think this made sense economically for the nation and individually for individual finances. So let me walk you through that. There have been literally 29 studies. Literally, I counted them. There may be more that I missed. Literally 29 studies by different economists that have shown that the economics works for the country. The economics simply work for the country. And 29 of these studies, they all say, of course there's new costs, but there's new savings. And that the new savings for the country are at least as high, if not even higher than the new costs. So there are now 3 that disagree with that, and I'm going to high level kind of point them out to you. But there are 29 that say this. And I'm going to walk you through just one at a very high level. So this one says, of course, there's new costs, but there's new expenses, new savings. The new costs are primarily because if we give people insurance, they're going to get health care, right? They're going to go to the doctor. They're going to get the glasses. They're going to get the hearing aids. They're going to do stuff. So that's what the new costs are. And this estimate is one of the higher estimates, says there would be about a 12% increase. Now, I said that there were 3 studies that didn't come to this conclusion. One of those studies literally stopped right here and just said, well, there's new costs. We can't talk about it. It's ridiculous, stupid. Well, there is another side to this spreadsheet. There's new savings. So what are they? First, it would obviously be less expensive to run one program than to run the hundreds that we run today. Secondly, we would be able to negotiate the prices of drugs. So that 6% is a 40% discount on the 15% that we spend on drugs, or 6%. So that's the arithmetic of that. So the country would reduce healthcare expense by 6% for negotiating prices. And we know that hospitals charge different amounts for the same thing, done maybe 10 times as much for the same procedure, not based on quality. So there's a savings if we control that and some fraud and abuse. Okay, so if you've probably noticed, those things on the right-hand side, those don't actually fund a program. So how exactly do you fund a program? So the first question, of course, is how much do you need? And I'm going to get kind of heavy on the economics for about 2 minutes here. But I think that's really important because that's the first thing you hear is we can't afford it, stupid. So how do you fund this? Well, first question, of course, is how much money do you need? So in 2017, this isn't controversial, how much money do you need? The number that I'm going to show you for this is actually the same number pretty much from the Koch brothers to the RAND study to almost any study. They're in the same ballpark numbers. So how much do you need? Last year, 2017, we spent $3.24 trillion as a country. If you increased utilization by 12%, you would have needed $3.6 trillion, but the savings that this model proposes. So we think we need about just under $3 trillion, $2.93 trillion. So look at this for just a minute, if you would. $3.24 trillion to $2.93 trillion. In other words, what's that? $331 billion savings?